Hey guys, my name is Lauren Dunn. I'm a student physical therapy assistant from Jeff State, and today I'll be presenting to you a case study for my PTA 232 orthopedic class. A little background on my patient is he is a 40-year-old male who was diagnosed with L5-S1 disc herniation. His symptoms occurred 1 week ago after picking up a 50-pound bag of concrete at work. He has a physically demanding job as a construction worker, and he complains of pain in his right lumbar area as well as intermittent shooting pain down his right posterior thigh. His symptoms increase when he is sitting or standing longer than 5 minutes, and with forward bending, coughing, sneezing, or upon first waking up in the morning. Objectively, the patient ambulates with an antalgic gait pattern with a decreased stance time on his right lower extremity. The patient also has decreased mobility and tenderness upon palpation to the right lumbar paraspinal musculature as well as the piriformis muscle. So today I'm going to be demonstrating a couple of techniques that we've been using in therapy. The first one being soft tissue mobilization. So all this is going to do is loosen up some adhesions that can occur after an injury has occurred. So I'm going to be using elongation, longitudinal, and muscle plate or muscle bending techniques. Hey guys, I'm Lauren Dunn. I'm a student physical therapy assistant from Jeff State Community College, and today I'll be working with my patient here. I'm going to be doing soft tissue mobilization to the lumbar paraspinal musculature. I'll be using elongation, longitudinal, and muscle plate. So first, what you're going to do is have your patient lay on their stomach. You're going to want a towel for modesty here, and I asked my patient if they wanted a drape prior to this, and she said no. So you get a generous amount of lotion here. I asked my patient to hold this. Okay. And you just apply evenly and distribute it evenly. Now my patient is complaining of pain mostly on his right side, so I'm going to focus on that side, but I'm also going to do the left side as well. So this is elongation. So you start in the middle and work your way out. And then doing this, if I find any knots that I may come across, I can hold sustained pressure on it and work it out that way. And now I'm going to be doing longitudinal. So you start at one end and go to the other. And the last thing I'm going to be demonstrating is muscle plate or muscle bending, and you grasp the muscle on either side and you just twist like this. And this will just help loosen up any tight musculature that she may have in her lower back. Okay, and just make sure when you are finished with your treatment that you clean your patient off so that they're not getting the lotion all over their clothing. The second thing I'll be showing is educating my patient on proper lifting techniques that would be beneficial for him to utilize while at work. The patient is eager to return to work as soon as possible, so these following techniques will be helpful to prevent any further injuries. My name is Lauren Dunn. I'm a student physical therapy assistant from Jeff State, and today I'm going to be teaching you some patient education on better, safer lifting techniques that you can use while you're at work, because I know you want to get back to work as soon as possible. So this will just help prevent any further injuries that may occur, and it'll protect your back, okay? Okay, so when you're at work, I know you do a lot of lifting, squatting, that sort of thing, because being in construction, that's what generally goes on there. So when we're lifting things from the floor to waist, we want to squat down, grab it with your hands, keep it as close to the body as you can. We don't want it to be out here. We want it to be close to you as possible, okay? So we're going to lift with our with our legs, not our back. We don't want to be bent over, so this is a no-no. Don't want to do that. We want to squat, put stuff down, squat to lift things up. Okay, do you have any questions about that? No? Can you show me? Just remember, use your legs. There you go. Good job. Okay, you can put it back in. Good job. All right. Thank you for working with me today. Thank you. Lastly, I'll be teaching my patient a home exercise that I want him to continue while he's at home. So he has been complaining of tenderness to the right piriformis muscle upon palpation and decreased mobility, and he also says he sometimes feels intermittent shooting pains in the right posterior thigh. So this could be due to a tight piriformis muscle, so I want him to stretch this muscle out. So I will be showing how to do this, so demonstrating it, and then I will have him demonstrate it back to me so I know he's doing it correctly. Hey, my name is Lauren Dunn. I'm a student physical therapy assistant from Jeff State, and today I'm going to be showing you a stretch that you can do at home. Do you have any questions so far? Nope. Okay, so what we're going to be doing is stretching the piriformis muscle, and I know that you've been having some radiating pain down the right posterior thigh, so this will just help stretch that muscle out so it's not pinching down on those nerves, okay? Okay. So I'm going to demonstrate for you first, and then I will get you to show me so I know that you understand, okay? Okay. All right, so we're going to lay it down on our back, just so we can protect your back. We're not going to be bending over it. We're going to pull this leg right here, and we're going to push down and stretch, okay? Okay. And we're going to hold this for 10 to 15 seconds, and then relax, okay? Okay. So we're going to do this on both sides, but we're mainly going to focus on this right side, and we're going to do this 2 to 3 times per day, but we're going to do 10 sets of it, okay? Okay. You have any questions? No? All right, can you show me that you know what you're doing? And you can just push down on this knee right here. That way you feel a better stretch right there, okay? Do you feel you're stretching? Okay. All right, that's how you know you're doing it right. The patient has progressed fairly well. He is now only being seen twice a week for only 2 more weeks. He is now able to return to work with a 20-pound lifting restriction. With continued home exercise and adherence to the proper lifting techniques, I feel as if this patient will resume his activities of daily living, or ADLs, by the time therapy has ending without further injuries occurring.